Hypertension is probably the most common condition that clinicians deal with in primary care in the United States. And one of the tools that clinicians use for dealing with hypertension, of course, are the beta blockers, drugs that have been out there now for over 40 years. But the question has to arise periodically, what is the current role of these drugs? Surely, since the beta blockers first came out, other classes of drugs have become available. And perhaps, Keith, you probably have a good perspective on this. Are beta blockers as relevant now as they were 20 or 30 years ago?
Well, Michael, there are no good drugs or bad drugs. All drugs have benefit and potential adverse effects. Beta blockers are still useful, perhaps not as first step, especially in persons over 60. And in some special populations, there are data that African Americans with conventional beta blockers don't respond as well for blood pressure reduction. But they're still useful, and they're still a very important part of our armamentarium.
How do you see it, Franz? Do you see the beta blockers as what you might call cornerstone of therapy, or?
I wouldn't say they are cornerstones of therapy, but of course there are indications for beta blockers in hypertensive patients, and if these indications are there, they should be used, absolutely.
Do you find yourself prescribing them often, Ken?
You know, I have a slightly different view. I think there's some fundamental principles that underlie how we approach hypertension. You either give vasodilation, you give, if they have fluid overload, you get rid of fluid, and if they have a fast heart rate, you know, you have to consider all of them. And in managing patients, I find that lowering the heart rate is a very effective way to treat the blood pressure. So that's my way of saying that yes, they remain a fundamental strategy for the definition of hypertension and its treatment.